Good morning, everyone. I'm Dr. Akhilesh Tandekar, and today we are going to discuss about organ donation and transplantation activities. As far as organ donation is concerned, this entity was uh, not very popular a couple of decades earlier, and then especially in Indian subcontinent, but it was very well established, in the Western countries. But India has also come up with the very strict laws, and organ donation act was also passed. And after that, the organ donation activity has improved. So if we see the global activity pertaining to the organ donations and transplantation, there are a lot of patients who are waiting for organ donations. The number of kidney waiting list is quite significant as against liver, heart, and lungs. The number of patients in the waiting list is ever increasing. And we see there has been a surge in number of patients who are in the waiting list. 2.6% increase is seen 2012 onwards. It roughly calculates that 10% of the global need of the organs that are required, and then 41% of the living kidney transplants and 19% of the liver transplants. These are the patients who remain who remain on the waiting list forever. And this is the list of states in India where you have seen the organ donations which are happening. Each state is probably contributing, not all states, but only few states which are contributing. And till 2012, the organ donations were roughly around one per year. That was very, very difficult situation. And you see in India, majority of the transplants are happening with the kidneys, and these are all from live donors. The family has to do sacrifice and provide a part of the organ, and then the transplantations are happening. So we are not dependent. We have to be completely dependent on the family for organ donations and liver transplant. 75% of the families contribute for liver transplant, and in heart, it's not possible. Okay, it has to be completely cadaveric transplantation, and lung transplant is also completely, cadaver dependent. And then we have seen the donor activity has increased, especially in the southern part of the country, Tamil Nadu being the highest, where the number of organ donations are highest, and Maharashtra is the second. And recently, we have seen that the Maharashtra and Tamil Nadu has equal activity as far as donations are concerned. And the organ donations can happen with either live donors. That is possible only for kidney and liver. And then brain dead patients, okay, they contribute, they become cadaver and they donate. They can be a donor for organs, and we call it as brain dead donors. Okay, but it's not like, we have to be completely dependent on patient who become brain dead and then cadaveric donations can happen. A lot of patients do have cardiac arrest, and these patients who die and they willfully, or their family members willfully wish to go ahead with organ donation, we call it as donations after cardiac death. So especially somebody who has massive cardiac arrest or deaths and they cannot be revived, and they go for organ donations, we call it as cardiac deaths. The numbers after cardiac death donations are very, very less. And what all organs can be donated? These are the eyes, can be donated, even skin, tissue, bones, and the intestine, hair, skin, bones. These can also be transplanted, and entire body can also be donated for teaching purposes, especially anatomical dissections, can be performed. And that is how it is. Like a living donor can provide one kidney, one part of a small part of the liver, skin, and bone marrow. Okay, but we have to go through a rigorous authorization process. Okay, when we have to look for a living organ donor, it has to be authorized by the local committee, and then state committee looks after if the organ donations are done from distant relatives or unrelated relatives, where you need to have a permission from the state committee also. And then brain dead patients, as I already told you, practically can donate all part of the body. I mean, all organs, basically, including skin, bones, and tissues, and eyes, and intestine, pancreas, and lungs, and the heart, and liver, and kidneys. Okay, worldwide, if you see the organ donations, Spain and Belgium has the maximum activity of organ donations, which is, more 30 donations per million population per year. And in USA, it is around 25 donations per million per year. And in UK, it is 21 per million per year. And India, it is miserable. The donations are just 0.5 per million per year, and we have a population of 1.5 billion, and the organ donations are very, very minuscule level. So that's why there has been prompt awareness about cadaveric organ donation in India, where the numbers are rising, but these are still not sufficient enough to match the demands of the organs in these patients. And then we have seen the sudden increase in organ donations after awareness. There has been 15 to 16% increase in organ donations. Okay, but these are maximum still from live donors, but not from the cadaveric organ donations. That's why government has come up with the registry. Okay, and the clinicians are also actively involved, and the social workers are also involved at community level to bring awareness about organ donation and break the ice, which is like an obstacle for organ donation. Like, there are a lot of social obstacles, religion related obstacles probably, or the views or taboos come in between, when the organ donations are discussed with the family or at the community level. So as we see, the maximum number of donations happen from patients who become brain dead after road traffic accidents. And India has the distinction of having highest rate of head injury worldwide, and then out of which, if you see in India, the 2000 data suggests that we had around 1,33,000 people who died, and 70% of these patients were brain dead. Okay, and then every year 1,000 lives are lost, and 1 million people are suffering, due to the serious consequences that they face due to the head injury or the trauma they face. So that's why in India there is a great potential of reducing the wide gap uh, pertaining to the availability and the demand of the organs for organ donations. And this is how in Mumbai the organ donations have been improved. And these are the organ donor cards. And so the patient is in a hospital, and it becomes very difficult sometimes to convince the family. So these information brochures can be provided to the families, and they can read and they understand, and close communication with the family members can definitely help us to maintain a rapport, and then the organ donations can be improved. So I am highlighting the important points of how to diagnose the brain dead patients and how to maintain the brain dead patients. These are important aspects, and a lot of questions may be asked pertaining to the diagnosis of brain dead patients. So as far as the Human Transplantation Act, which was established in 1994, okay, a diseased person is someone who has permanent disappearance of all evidence of life. They may be it may be in the form of brain stem death, or it may be in the form of cardiopulmonary deaths. And then brain death means the patient is, patient has lost the brainstem functions permanently and irreversibly, but the other organs are functioning. We call it as brain dead. Brain dead. So how do we establish somebody has become brain dead or not? It has to be established with documentation of coma. The patient has gone into an irreversible stage of coma. The pupillary reflexes, breathing, pupillary reflexes are lost. Patient is not breathing and he is not responding. There is no motor activity even to the painful stimulus. And, the brainstem reflexes like pupillary reflex, cough reflex, gag reflex, auditory reflexes are absent. Uh, or the dorsal reflexes are also, uh, absent. So then we call it as having the patient is having brain dead clinically. But apart from the clinical parameters, it can be also established with some invasive diagnostic modalities by demonstrating the absence of blood flow in the intracranial vessels. And that can be done with imaging studies of MRI, CT scans, and angiography can help us to identify. Even Doppler methods can also help us to identify the flow in the major vessels of the brain. So in order to diagnose the patient as brain dead, we need to go through few steps. So there are 4 steps under which, after which, if all the 4 steps are fulfilled, then probably we can consider that patient as having, brain dead clinical scenario. The first step is we need to establish the cause of brain dead, cause for the brain dead, clinical situation. Okay, unless we establish a cause, we cannot go ahead with the identification of brain death or investigations for the brain death, diagnosis. So it should not be initiated. Brain death diagnosis should not be initiated without any cause. There is always a cause, but whether it is brain dead, stroke, or intracranial hemorrhage, or any kind of cerebral dysfunction that has been a result of hypoxic brain damage, okay, or any cardiorespiratory arrest which has led to permanent brain damage. So we need to establish the cause, and then only we can proceed.